Welcome to Hope for Med.
Hi, everyone. Welcome back to the Hope for Med podcast. I'm your host, Dr. JB, and today's featured guest is Dr. Nerissa Bauer. She is a behavioral pediatrician, CEO of Let's Talk Kids Health, and creator of Teach Me ADHD. She is passionate about helping families become confident in navigating the road ahead after a diagnosis of ADHD. She left academia due to burnout in December 2018 and found her way back to serving families in a way that aligns with her passion and her purpose. Welcome to the show.
Oh my goodness, I am so excited to be here. Thank you so much.
And I'm very excited to have you as one of our featured guests today. So let's start from the beginning, shall we?
Yes.
Can you share with my audience your origin story?
Oh my goodness. Well, so I'm a behavioral pediatrician by training. And, when you go to medical school, you think, I'm going to go and learn to be a doctor so I can help people, right? And even before I went to medical school, I knew I needed to work with kids. I actually started college as an elementary education major. But life happens and I fell in love with psychology, knew I had a thing for science. So melded all those things and knew pediatrics was it. So, got into medical school, got into residency, and then realized during residency training, I really loved helping kids who think and learn differently. So that's how I became a behavioral pediatrician. After that, I went into fellowship and for research, because at the time I was training, and I'm going to date myself here, is when Columbine happened. And then shortly after that, Santee happened, which was in San Diego. And I was seeing kids with nonspecific symptoms, realized quickly, I need to do something about this. Got a grant, wanted to give out gun locks, couldn't give out gun locks. Nobody wanted to tell me they had guns in their home. Realized I needed to kind of figure out public health influences, hence another fellowship, to learn more and to get my master's of public health. Very quickly, while I was there, started a foster care clinic and realized at the time, I didn't really know how to support families. I didn't have kids of my own. And, people were like, you're a pediatrician. Shouldn't you know how to do this? However, as you know, kids with in the foster care system have a lot of behavioral health and mental health issues. Sometimes medication is warranted, but more often than not, it wasn't. Families needed that support. So I was like, oh my goodness, I don't know what to do. And luckily found an eventual mentor, Carolyn Webster Stratton, who developed the Incredible Years. She graciously invited me to sit in her parenting group. And then through that experience, invited me to also watch all the videotapes, meet with her leaders. And then, so not only was I learning content by going through it, but learning how she was thinking and how to make this work, the group therapy part of it. And realized very quickly, as I finished the program, as the only person to date who has gone through her program without kids, because at the time I didn't have any, realized as a pediatrician, we are not taught those skills in this way. It's do one, see one, teach one, right? And it wasn't very systematic. So with her permission, when I got my first faculty position at Indiana University, started a behavior clinic, running the developmental behavioral peds rotation, decided I needed to help bring this curriculum into residency training in a systematic way. And so adapted it, worked with her, and then really fell in love with just trying to make my mission to help pediatricians feel comfortable dealing with behavior problems, how to identify, and then how to incorporate this in a more holistic approach to talking to families about behavior. And then fast forward to, helping a lot of kids with ADHD. And, it's one of the most common neurobehavioral conditions that we see. And COVID happened and realized I had the skills to help. So I'm going to leave it at that for now. But, I have this passion for helping kids and families who think and learn a little bit differently And how I got here, it's like, I didn't know I would be doing what I'm doing now,
Mhm.
but life has a funny way of working out.
Isn't that so true?
Yeah.
You know?
Yeah, it really is. And I think too, as a physician, we think, gosh, I'm only a doctor.
Mhm.
Only a doctor, right? But when I got into burnout very quickly, I was like, oh my gosh, what am I going to do after this? Like,
Mm.
I don't even know what can I do? I'm only a doctor,
Yeah, yeah.
right?
So
So,
let's explore that a little bit more. What do you mean when you got into burnout? What was
oh
happening?
yeah. So I was very happy in the first part of my career, and I credit a lot of my life experiences to who I am today. It just got to the point where as I was moving further into my career, I was promoted to associate professor. I was at in academia for 13 years at Indiana University. I didn't realize it until later that I was burned out. And I was in this faculty position where the expectation was I'd have to write a grant every cycle. I would write grants related to helping general pediatricians identify and intervene on behavioral issues in primary care. So totally my jam, totally what I wanted to do. Um, but when grants don't hit,
Mm.
it's really hard because I fall in love with the idea. I've poured like several months of writing this awesome plan and how I'm going to do it, only to find out it didn't hit. And then, as you know, in academia, if your time isn't covered, you're either asked to go back and do more clinical time or put on different committees, which means meetings
Mm.
with to-dos.
Mhm.
But the expectation is still to write grants. So um, over time, I was writing grants in the weekends, at night, and to the point where my kids were like, Mom, you're not taking your laptop with us. We're going on vacation, you
Mm.
know,
Yeah.
right? And
Mhm.
so I'd hear things like that. Um, but it wasn't until two of my family members got ill, one being my husband and needed emergency surgery, which then kind of domino effect of me taking on my job, my kids, my two dogs, and getting him, to and from places. And then my dad, who lives elsewhere, was in the ICU for a couple days, and just a bunch of stuff happening. And it made me stop and realize, okay, what is the universe trying to tell me here? I just can't take any more.
Mhm.
And it was like the universe was trying to say, okay, you are not happy.
Mhm.
And I realized too, with things that happen with the people that I love, like, life is too short, like, and I'm not happy.
Yeah.
I need to refocus on what it is I need. And it was at that moment that I realized, wow, I really haven't been happy in my job for a while. You get into that rut of just same thing over and over again, get the kids to school, go to work, do this, do that, come home, work late into the night, go to sleep, wake up, and you don't really notice until something happens. I mean, at least that was for me. I had a wake up call. I really feel like the universe was like trying to tell me something, and it made me reconsider what I wanted to do. Because at that point, I was just struggling to stay above water, and I
Mm.
didn't realize it. But I think, as I started getting this nagging feeling of, whoa, um, hmm, something's not right. I don't
Yeah.
feel the same when I'm going to work. I started realizing that I was moody. I was um, getting kind of more frustrated and irritated with my coworkers, or just my to-do list that just seemed to be growing. And I just wasn't happy.
Mhm. Mhm. And so when you started realizing that, like how long did it take you to make a transition?
Well, so it was a good 6, 7 months of me sort of helping get our family back, kind of in order, like at least where I felt like I could breathe. But I started as my husband got better and my dad got better, like everything slowly got better, right? But we started talking, me and my husband, about how I was feeling, and at that point he had already left his job a couple of years ago. So he sort of came at it from the standpoint of, you did a lot, and I, for our family, got us through. I know that we're going to be okay because I was able to leave and landed on my feet. Let's do that for you. And when he said that, I literally started crying. Like, I had no idea that was even possible. I mean, even though I'd seen him do it, I didn't realize how much I needed that life raft at that moment. And it was a gift. I mean, I will say this out loud. I fully acknowledge that I was in a very different position than maybe other friends of mine who felt burnt out and couldn't leave because they were the main breadwinner. They had to figure out insurance. They had, there was just so many other considerations. But we were in the position where I could just leave. And all of a sudden I was like, wow, I could just leave. And when we talked about this, we kind of laid out, okay, so how are we going to do this? What are the things that I need to do to kind of line up things? And then put this plan into motion, and started with, alerting the higher ups, and then slowly it trickled down. But it took, I would say it was like 3 months of from when I made the conscious decision to then when I fully left. So, but it felt like an eternity, like keeping that private, and going through the motions, going to the meetings, knowing that I was going to be wanting to leave or will be leaving, and feeling like, why am I just here? I feel so ashamed that I'm leading my colleagues on, not letting them know. But it was kind of this weird period where I knew this and I couldn't tell anybody yet. But when I did, I'll tell you what happened.
What?
People were like, oh my gosh, where are you going? They assumed I was going to go to another academic institution. And I was like, I'm not going anywhere. They're like, what? What are you doing? I'm like, I have no idea. I've been burned out. I have no idea. I need time to just stop and figure out, is it the research? Is it the clinical? Is it everything? Is it the patient care? What is it? I just need to get out. And some people were like, okay. And then some people were like, how are you doing this? Leaning in, tell me how you're doing this, because I kind of want to know, So, yeah.
So you left without necessarily a plan B. It was just, I just need a sabbatical, kind of to figure it out.
Yeah, I know. It was weird. And I was doing a lot of reading of maybe trying to find a bridge job, just to get out. And that's what my husband did when he left his job initially. But for me, again, we were in this place where he was good. He was better. He was making good money. I mean, gosh, we're physicians. We were not going to struggle. We just had to rein in our expenses and change the way we lived for a little bit, but it was doable. And again, it was weird. It was weird. I just got out and I started volunteering at my kid's school, and I was going to Costco in the middle of the day, and I was looking around this is so strange. I've never had this experience before. But then I got really itchy. I knew I loved the time, kind of just getting back to taking care of myself, getting good sleep, being with the kids. But I just felt like I needed something else too. So after about 4 months, I was like, well, I could go back and be a doctor. I know how to do that. So I started a private practice, and then sort of still had some time to figure out what else. And so I took that time, because I also was very scared of kind of getting burnt out again.
And so you mentioned your husband was a doctor.
Yes.
He got out. So can we talk a little bit more about that, and what happened with him and what made him decide to leave?
Oh, his story is a little bit different from mine. I mean, he's med peds trained, and we both went into academia at the same time. He was working as a service chief, peds hospitalist here in town. Um, he's like he's a great clinician. He loved teaching. He got so many accolades, and then the opportunity to become a section chief came up, and everybody's like, you should do it, you should do it.
Mhm.
And he did. He got they did a national search, they interviewed, and then he got the job, and it was great for a while, but he quickly realized that he really wanted to be a clinician. He was not like, he didn't want to do the administrative stuff, and
Mhm.
but it was such a demanding job. I think the people that were in that position before him, like, 4 or 5 years, that was probably it. And he
Mhm.
kind of reached that
Mhm.
for lots of different reasons.
Yeah.
And that's his story to tell. But
Yeah.
he just was like, okay, I just need to pivot. And
Mhm.
so he did. The interesting thing is he took a job with Anthem, actually, and started working there, doing some med utilization reviews, and he got to work from home, not working holidays, not weekends, no call. It was weird but awesome,
Mhm.
to the point where my daughter, she was young at the time, she was like, Mommy, Daddy does it this way when we go to bed. I'm like, oh, Daddy has a way? Oh my gosh, because Daddy is home now. He can put
Yeah.
you to sleep, right? So that was just an amazing experience for our
Mhm.
family to reacclimate to seeing what was possible, you
Mhm.
know,
Mhm. Mhm.
again.
And and when your husband transitioned out of, working in healthcare, at that point in your career, you were
I was fine.
fine.
I was good. I was, still really happy and still doing
Mhm.
great. So I mean, I'm thankful
Yeah. Yeah. Yeah.
that
Yeah.
it happened this way, because it was staggered.
Yeah.
Yeah, because I don't know what it would have been like if we were both sort of in feeling the same thing at the same time.
Yeah.
Yeah.
So that's amazing. So you took 4 months off, and then
Yes.
you opened up your private practice, and then
Yes.
you're like, what else?
Yeah, 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 exactly. I sort of knew, given kind of, the work that I do, and this goes for everybody who does, their own field in medicine. There's just things about it.
Mhm.
I love the kids, but I'm such an empath. Like, I feel so much. And, with behavioral medicine, there's not like a quick fix. I mean, oftentimes there's so many different stressors and risk factors, things that you can't control, family circumstance, all of these different things, trauma. But I want to support these families in so many different ways. But sometimes it felt like, oh my gosh, I can't. Like I just need to sit with them and know that I'm here. I'm like with them on this journey, but I can't like send them to surgery to get something taken out. I can't give them a medicine and make it like just go away. I mean, yes, for ADHD, maybe sometimes, but like, no.
Mhm.
So I just knew that um, doing one-on-one patient care with this type of work, I probably couldn't do 5 days a week.
Mhm.
But I loved connecting with families. So I started thinking about different things. I told you I was trained in the parent training work. So in my private practice, in addition to one-on-one, I also started offering parent training groups, which is so needed.
Mhm.
But then COVID happened. COVID happened, and then all of that went away because I couldn't safely get families together in the small conference room we had at the office. Luckily, I was able to transition my private clients to telehealth. I did that for 18 months straight, especially for behavioral health. I don't need to look in their ears
Yeah.
necessarily or do things. So I was able to transition, luckily, to telehealth pretty seamlessly.
Mhm.
But a couple things happened. So during the pandemic, as everybody knows, we were all just trying to figure out what was happening, what was life going to be like, and juggling home, work, and everything in our houses.
Yeah. Mhm.
And parents were struggling. I mean, my own clients, and then seeing the things on social media, I knew I couldn't do the parent training group. So one day I was just kind of sitting there thinking, how am I going to continue to support these families? Came up with this idea of a book club. I just ran it by one friend. She goes, oh, that's a great idea. So I just announced, hey, I already at this point had like a Facebook page and was slowly starting to interact and dabble in that space. But I kind of just said, hey, I'm going to be reading this book for the coming month. If anybody wants to read along, great, let me know, get the book and let's talk, you know? So I sort of made it this kind of cute thing where you can read along in your pajamas, no one will care, no one will know, answer questions whenever you want, you know. Because I just know that with parenting, there's not a one size fits all approach. Certainly a lot of the work you do in groups is to help them learn the principles, but then how to generalize and apply it in their circumstance. So the parenting book club, you know, seems pretty easy, reading books, and you're like, oh, wow, this is great, but then it doesn't work. So I wanted to sort of offer something like that in that form. And so I offered it on Facebook. I still wasn't quite sure what that was going to be. I just kind of started doing that. And then January of last year came up with this idea again, just like, here's an idea. And because I'm an extrovert and I missed my friends, and with social media, anybody can put anything out there. And so I knew that there was so much misinformation. And I knew, especially with pediatric behavioral health, there was so much to say, so much stigma. So I kind of, again, called up a couple of my friends, say, hey, would you be willing to talk to me? Because I miss you, but it would be amazing if we could do this like live and broadcast it out to everybody and share like information that people need to hear about. And so that started my Let's Talk Kids Health live show that I've been doing weekly since then. And then lastly, in October of 2020, as remote learning was like in full swing, schools were now at least figuring out that they needed to do some format of remote learning because schools couldn't reopen. Kids were struggling for lots of different reasons in that capacity. And I was just like, oh, wait, I can help these families. I can help them, you know, understand what ADHD is, what it isn't, but bring together my skills of positive parenting, working with kids, and developing this program, which now I call Teach Me ADHD, which is the only class of its kind where kids with ADHD and their parents take it together with other families.
Oh, wow.
Yeah. So it's a Zoom class. And yes, I know parents were like, no, not Zoom. We're Zoomed out, you know, but I'm like, how else am I going to get to you guys? Like, we can't get together. So I knew it had to be fun, engaging. I made it a detective theme, the All Deeds Help Detective Agency. I put together a supply box. Parents and kids become detectives. They adopt code names. And then I develop family missions and deeds that we work on week to week. And then parents have to take pictures of evidence and send it to headquarters for feedback. And all of these are crafted to help kids and parents onboard together about what ADHD is, what it isn't, work on executive functioning skills, and set in motion systems for home and school so kids thrive. But because kids and parents do it together, they're like so eager to talk to each other and connect. And so I've come up with these fun things, and now I've done it so many, like I'm in the middle of selling right now, but I've helped like 60 some families from 8 different states, and it's growing. And I love it. And I'll just tell you that, like, right now, did I know I was going to be doing this when I left academia? Heck no, I did not know. But in the end, like, my grants were really about helping families, helping pediatricians identify kids early, and infusing this positive parenting, behavioral health into strengthening parent-child relationships. And I am so grateful that, like, COVID happened to help me push me outside of my comfort zone and make me like think outside the box, because there is this gap, there is this need. I was seeing it and I was like, okay, I'm going to go for it. I'm going to go for it. And it's been amazing. It really has been.
And you did it. And it's just so creative. I was just like following along, like, yeah, the detective and the headquarters, you know what I mean? It reminded me of like Inspector Gadget, you know?
Yes. Yes. And who doesn't like maps? I mean, I wish I could show
Yeah.
you it right now. It's like over there, but like I was like, I gotta make a map. I gotta make a map. Like kids like maps, you know? So it's like this map of like, you know, mission 1 through 8, and parents and kids have their own top secret mission, and all of these different things. And I mean, so it's just been so fun. And when I like put it together, I'm going to just tell you one more quick story. I put it together and I'm like, okay, I think it's going to be like 6 to 8 weeks. And at this point, you know, I had run groups before for parents, but I'm like, okay, 6 to 8 weeks. I think this is what it's going to be. But to try it out, I need at least 3 or 4 families. So I just made a flyer, put it out on social media. I'm like, okay, I need some families. I tell you, like within a week, I had 7 families that were like, oh my gosh, we're so in. Whatever it is, sign us up. To me, I was like, this is so strange, because in academia, like when you're writing grants, you need to know exactly to the penny what you're going to spend your money on and like a 5-year plan, you know, like, right. And here I was being loosey goosey saying, well, I think it's going to be this. I think it's going to be 6, 8, you know, like here are the possible topics. I think it's going to be an hour. Like, and parents are like, yes, we need this. Thank you. And I'm like, okay, I'm going to do it. And I just have not regretted any moment since. And it's just like, these are the people I want to help. And here they are saying, yes, help us. We are willing and able. And that was what I needed to sort of just remind me that even though I'm only a doctor, like I've had experiences along the way, which really culminated in the time being right for me to be the one to create this awesome thing out of nothing, and to see the transformations the families have and the connections they're having, and it's just so heartwarming. And like, to me, that's why I do what I do. I mean, in the end, that's why I wanted to get those grants. That's why I wanted to help these families. That's why I do the patient care that I do. I want to help these families, and I get to be part of this journey, and they're like happy, they're doing it. And kids are embracing the fact that they have ADHD, and they have tools in their toolbox now. It's really amazing.
That's absolutely amazing. That's absolutely amazing.
I'm sorry, I'm like so excited whenever I talk about it, because I'm just like, it's so fun. So fun.
No, because it is. I mean, and you're just so creative, you know? I was just like, how did you even like come up with this idea? And you came up with this idea and it aligns so perfectly with your values, really, with like what you really wanted to do, and without any red tape, right?
I know. I didn't have to get permission. I didn't have to
You know,
wait for like some funding agency. Well,
no
you know, I mean, I had to,
IRBs,
you know,
right?
right.
Like,
I just did it. And that was what really is exciting about entrepreneurship, but also scary at the same time, because being who I am today, like I didn't know anything about business. I mean, even when I started my private practice, I was like, what is an LLC? What
right,
is this? What do I have to do?
right.
Like, you know, so we don't get that training in med school. And I don't think we do a good job at sort of showing physicians like what the options are for us. But I think so many of our colleagues have been burnt out from the pandemic, just being on the front line and dealing with misinformation. And it's been really hard to see some of my really great friends and colleagues across the nation just wanting to leave medicine, not having hope anymore, you know, and then not sure what to do. So I'm so grateful that you're doing this, because I think it just highlights the fact that, you know, we all went into medicine for our own reasons to help people. And there are lots of ways that we can help people. It just doesn't have to be the one way. Yeah.
And you're not just a doctor.
No, just a doctor, right? You know, I know. And I feel like I told you I wanted to be an elementary education teacher when I first
Mhm.
started. Like, I feel like it's almost a little bit like here I am designing worksheets and things like that. Well, guess what? I'm going to tell you a secret.
Mm.
I just formally got diagnosed with ADHD myself a month ago.
Oh, really?
And I think partly that's why I get how to do this, because my brain thinks and learns a little bit differently too, right? I feel like I have a way that I like to think through things, and it's really helped me be able to connect with the families and the kids in that way.
Mhm.
And when I told a couple of my now friends who've taken the course and they were physicians themselves and they did it with their kids, I told them, oh my gosh, I got tested and guess what? I have ADHD, moderate inattentive type. And they're like, oh yeah, I totally could tell. I'm like, oh yeah.
What made you get tested?
Yeah, well, so two things. One, my son needed to get testing because, we were noticing, as a behavior, I was like, oh gosh, not turning in assignments, like having to like help a lot more. Did you check this? Did you do that? Like all that scaffolding we do. But really, when I left academia, I had no idea how much that structure was so needed.
Mm.
Those deadlines and those meetings, that was the structure that I needed to get through my day. And when that went away, it was like, oh, where are my keys? Or, oh my gosh, I'm supposed to be doing what? Like,
Mhm.
bills. Did I pay that bill? I don't know. Like
Mhm.
those
Mhm.
things started becoming way magnified. And I just was trying to feel like, oh, maybe, maybe that I need some help.
Mhm.
Um, but when I tell the kids, I don't tell them right away, but I usually tell them like 6 weeks into the 8-week course. Guess what? I have ADHD too. They're like, what? Like, what? And I'm like, yeah. I mean, I want these kids so much to just realize that they have a gift. It's
Mhm.
not a disability, it's their ability, it's their unique ability, and they can learn to love themselves and reach for the stars, and just know that they might have to work a little differently than other people or creatively,
Mhm.
but they can do it. And to not let having ADHD stop you. But so many of these kids, as you know, who have ADHD, they oftentimes hear so much like negative feedback, like, don't
Mhm.
do this, why are you doing this, why'd you forget this again, like, can't you sit still, stop doing that, right? And
Mhm.
so a lot of these kids internalize those feelings of like, I'm no good, I'm always the one getting in trouble, no one likes me, I am a failure. That inner voice is
Mhm.
so amplified. And so my goal with this course is really to help them understand what it is, so they're not scared, they're not embarrassed. They learn tools and they learn systems, they learn how to talk about it with their parents, their doctors, their team, and they learn that ADHD is my superpower.
Oh, wow, I love
Right?
that.
Yeah. I mean, it's just, again, I just can't tell you. Like, I just love this work. I just feel so good about what I'm doing now. I'm
Mhm.
reaching the families that need it, and I'm doing it on my terms
Mhm.
and in my way.
In your way. Yeah. I love it. Man, this story completely blew me away.
Oh,
Yeah.
thank you. I mean, it's been a ride.
I mean, especially, with what you said about when we go through our training, we don't get taught about business. All these things that I'm doing, I learned, um, Google, read some books, you know what I mean, to kind of
Yes.
do it. And so, there's such a steep learning curve because now you're not on your same field. You're in a whole different field right now.
Mm-hmm.
But we're not just doctors, right?
Yep.
And so there's a lot of new skills that we can learn,
Yeah.
and develop, and nurture, that can kind of merge with the skill set that we have as
Yep.
physicians. And and do something even more amazing and still be able to be effective with people, with patients, because that's what we do every day is we talk to people. That's our job, and connect with people, and really just try to make things better for people.
Yes, absolutely. And, if you can learn how to intubate somebody and
Mhm.
code someone, I mean, you can do hard things. This is different. But it's learnable. And I think sometimes when I was sort of in this space of, gosh, do I put it out there? What if people don't like it? Or what if it, like, what if I think it's a great idea, but nobody else wants it, right?
Yeah.
It's scary to put yourself out there in a different way.
Mhm.
But if you don't try,
Mhm.
you'll never know. And it worked out. It worked out for me, and worked out, it just was meant to be.
Mhm.
And so, yeah.
Well, if my listener wanted to find out more about what you're doing, how can they do so?
Oh, thank you. So my website is letstalkkidshealth.org all together. And it has everything on there from my private practice, my book club, my live show, and my courses. And so that's where you'll want to go. Please reach out to me if you have any questions about anything, not just what I offer, but just like my journey, how
Mhm.
I did it,
Mhm.
because I'm always happy to sort of help, just because I've been there, and I know that sometimes it can be really scary, but sometimes just having someone to kind of talk through things like, oh my gosh, how did you do this, how did you do that, and hearing that there's hope out there. There's not one path, there's so many paths, but we need to sort of just remember we're not just doctors. We can do real things to help our families. And that's where the fun is, I think.
In closing, do you have any pearls of wisdom you'd like to leave my listener?
Yes. So if you're feeling burnt out, depressed, hopeless, that is your cue to just know it's going to be okay. You need to ask for help. I think sometimes as doctors, we want to appear that we can do everything and anything, but we're also human too. And again, I'm a big advocate for this because I work in the mental health space. I think if you're a parent, kids can feel it when you're not functioning at your best. And it really behooves everybody if you can get help, for that. So there is help, there's no shame in it. And there's a supportive community who want to see you succeed. So, take care of yourself, and then give yourself permission to think about what else you can do, because anything is possible.
Yeah. Who says a doc can't rap? DOCTORJB. The greatest doctor to ever touch the mic. The greatest podcast ever broadcasted or pre-recorded. Come learn some. Each one teach one. I'm done.